We watch an ACL surgery as a class, but that is only the beginning of a very long recovery process. The average recovery time, or the amount of time it takes for an individual to be completely cleared for all physical activity, including contact, is about 9 months. Now, it is a very long healing process, and the timeline completely depends on the recovery rate of each individual, so the timing will vary. On average, however, the process is as follows. The first few days after surgery, the individual must rest, ice, and elevate their knee to reduce pain and swelling. Within the first weeks, he or she can begin simple leg lifting exercises to rebuild surrounding muscles which have atrophied and to regain extension and flexion of the knee joint. At about 3 weeks post-surgery, he or she may begin to work out on the stationary bike to help loosen the knee and improve range of motion. Also, individuals can be fully independent of crutches and begin walking with the brace. However, it is recommended to use crutches in public as a buffer so that others are warned and more careful around the injured person. As the individual continues to meet with a physical therapist, more activities will be added into the rehabilitation program, such as jogging, pool exercises, running, and eventually jumping and side-to-side movements. After completing all the rehabilitation requirements, the individual can work back into the swing of things, and once cleared by their doctor, may start doing contact again. As I said, the average recovery time for this stage is about 9 months. Because this is such a common injury, many athletic clubs are working to establish prevention programs. However, this is not guaranteed to protect the ACL, only reduce the chances of a tear. The keys to prevention are: 1. Strengthen and increase the flexibility of the surrounding muscles, especially the quadriceps and the hamstrings. 2. Include plyometric exercises or dynamic stretching into trainings and warm-ups. 3. Emphasize landing correctly after leaving the ground. Feet should be shoulder-width apart, knees should be bent, and majority of the impact should be absorbed by the balls of your feet.
It's our problem-free philosophy. Hakuna Matata.